I think the most underreported and most underrecognized and poorly understood area of MS therapy is sleep disruption. Sleep disruption is a very prominent part of many of our patients' lives. We end up treating a lot of our patients for fatigue, the most prominent symptom with MS, with a variety of stimulants or amantadine or other medications. But oftentimes I don't think we get to the understanding of what is at the root cause of their problem with fatigue, and many times it is sleep disruption. So many patients will have spasticity at night, and that will disrupt their sleep and wake them up or keep them up, causing pain, and they have to get up and move around or take a medication or something else. They'll have sleep disruption because they have to urinate four or five times a night, and that'll disrupt them. Of course, they're going to wake up fatigued. But then they might also have pain syndromes, or they might even have a primary sleep disorder, obstructive sleep apnea, or REM sleep disorder, or any of a variety of other primary sleep disorders that many studies have shown to be at a higher frequency in MS patients than in the general population. So I think that what we really need to focus on when someone comes into our office and says, I have fatigue, is not just to treat them with a medication for fatigue. I think we should avoid the concept where we treat their fatigue in the morning with stimulants and then treat them with sleeping agents at night to put them to sleep, because I think we're missing the point.
In my experience, I have an easier time in talking to patients, communicating about the visible consequences of multiple sclerosis than about the invisible ones. And I think what that means for me is that very often sleep disorders, fatigue, and mood and anxiety disorders are under-recognized and often undertreated. This is a challenging issue. Often these problems have more than one cause. For instance, when a person complains of fatigue, this could result from overexertion of weak muscles. It can result from poor sleep, and the poor sleep can result from worrying or anxiety or the need to use the bathroom during the night. But also they're often associated primary sleep disorders such as sleep apnea, restless leg syndrome, periodic leg movement of sleep. And it is very important to recognize these, make appropriate referrals to sleep specialists, and seek appropriate treatment both of the sleep disorder, the fatigue, as well as the mood and anxiety disorders.
There are several aspects of MS that I think are under-recognized and undertreated in this day and age, where we're really concentrating on disease-modifying therapies for MS. One of those is neurogenic bladder. Patients with MS may have difficulty with bladder symptoms and may be somewhat reluctant to discuss them with their physician, or the physician may consider it to be the realm of another physician, such as their family doctor, gynecologist, urologist, or somebody else. However, in the care of multiple sclerosis, it's important to keep track of particularly bladder infections. Patients in this day and age can go to an urgent health center somewhere, an emergency room, the family doctor. They may get treated in different ways, and nobody is recognizing that this is a recurrent problem. Cognitive change in multiple sclerosis is also very important. It is not easily detectable usually. Most people with MS who have cognitive change have relatively mild changes. However, those changes can be very important in this day and age, particularly when we're talking young people who are working, young parents. They may be multitasking, trying to do 2 or 3 things at a time. MS cognitive change is not easily picked up by our little bedside tests like the Montreal Cognitive Assessment or the Fulstein Mini-Mental. It requires some vigilance and awareness, and then the awareness as well that not everyone who feels they have cognitive change does. Sometimes it may be due to mood problems or other issues, but cognitive change is going to reflect on medication compliance, the ability to be organized about not only work but other aspects of healthcare and life.